We are live now.
Good. Okay. Okay. Good evening, delegates and faculties members, and thank you for joining Shield Connect. I also thanks participants who are joining for today's webinar. So, as we know, every this day we have a webinar with Dr. Ritu Santwani ma'am, and today icon of the day is ma'am herself, and ma'am is going to speak on the topic role of vaginal microbiota in fertility. So let me introduce Dr. Ritu Santwani ma'am. Ma'am has done MBBS, MD, FICOG, FIOG, AMR, COG. Ma'am is obstetrician and gynecologist in IVF department. Ma'am is the founder and CEO of 360 Degrees Healthcare Studio. And ma'am is also consultant at Inamdar Multi-Speciality Hospital from Pune. And ma'am is infertility test tube baby specialist. Ma'am is also part of NUHS Singapore, co-founder of MAAM, board member of SWWC. So I welcome ma'am for today's this topic, which ma'am is going to take. And as you know, this week is as a antimicrobial awareness day. So I hand over the session to Ritu ma'am. Thank you, ma'am.
Yeah, thank you. Thank you so much, Nishant. Thank you, Shield Connect. Thank you, Sahiti. Thank you, Chitra. Thank you, Dr. Prachi, for providing the platform tirelessly every week. So, friends, as all of you are aware, every Thursday we are going to discuss, we are already discussing every Thursday one different topic. And today the topic which I am going to cover is the role of the microbiota for the infertility. I think all of us are getting the patient in the OPD with this different vaginal infections. Although we are yeah, Renu madam has joined. Yeah, thank you, Renu madam, for joining. Madam has joined from Kanpur. So all of us getting the patients of this different infections, and I am to giving this vaginal microbiota preparations, different preparations in the different clinical conditions, good results in the patients of the PID also, good results in the patients of endometriosis also. So now without wasting time, I am sharing my screen. I'm just checking for the YouTube live as I received one message that YouTube live is not coming. Saiti, give me a minute. I am checking. Huh?
Okay.
No, it's coming. Yeah. So I'm sharing my screen. Yeah. Visible, la? Nishan? Nishan?
Yes, ma'am. It is visible.
Visible, yeah.
Yes, ma'am. Yes, ma'am.
Yeah. Okay. Thank you. So, hello everyone. All the presentations will start, whether the national or international, with the Stuti of the Mata Durga. Ya Devi Sarva Bhuteshu Chikitsa Rupen Sansita Namastasyai 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 Namo Namah. So, what's the role of the vaginal microbiota in the fertility? The vaginal, as we all are aware, the vaginal microbiome plays an important role in maintaining the woman's overall health. The vaginal microbial community plays an important role in the vaginal innate immunity and the inhibition of bacterial, viral, and yeast infections. The urogenital site contributes 9% of the entire human microbiome, as compared with GIT, which comprises up to the 29% of the total. So we all are aware that this vaginal microbiome is dynamic and changes throughout a woman's lifetime and is commonly dominated by the lactobacillus species. So lot of studies has been reported in the favor of this. This is the article is published recently on 7th April 2021 only. the role of the female vaginal microbiome in health and the bacterial vaginosis. So what are the key points are mentioned in this? Vaginal health is influentially significant to human reproduction and public health. It has attracted less attention. The vaginal microbiome is an integrate and dynamic microecosystem that constantly undergoes the fluctuations during the female menstrual cycle and the woman's entire life. So we all are aware this indigenous environment microorganisms and their genomes jointly comprise the entire habitat, also known as the vaginal microbiome. So now what is this homeostasis of the vaginal microbiome? Here you can see this how there is a equilibrium between the aerobic and anaerobic microorganism, and this vaginal microbiota plays a pro-vital role in preventing the colonization by the microorganism responsible for the genital infections. The composition of the vaginal ecosystem changes in response to exogenous and endogenous influence. So as we know, there is a balance of, in the vaginal homeostasis, there is a balance of the harmful bacteria and the good bacteria. Just a second. Yeah. I don't know why the slide is not moving. Yeah. So the studies have shown there are the different groups of the lactobacillus. In this, the group 1, the names are like that. Lactobacillus crispatus, around 26.2%. Now group 2, the lactobacillus gasseri. Group 3, bacillus iners. Group 5 is the lactobacillus genesi. And group 4 is classified as a non-lactobacillus dominated, and it include Gardnerella, Petrovella, Corynebacterium, and Atopobium. During the reproductive years, the high circulating levels of estrogen and progesterone, lactobacilli dominance in the vagina, estrogen deposition of glycogen in the vaginal epithelium, progesterone supports the cytolysis of epithelial cells, glycogen release the lactobacilli, metabolize the glycogen into the lactic acid, and normal vaginal pH to be 4. So here we can see, friends, the microorganisms are present not only in the vagina, but also the upper female reproductive system, including ovaries and the fallopian tubules and the uterus. So studies have shown that the many different bacteria usually inhabit the vagina, lactobacillus, which excrete the H2O2, creating an acidic environment, which is a natural disinfectant and that acts to maintain the normal balance of the organisms in the vagina that is hostile to disease bacteria. Any condition that changes the vaginal acidity or disrupt the normal bacteria in the vagina may predispose to an infection. There is a delicate balance between the two major microorganisms normally found in the vagina of the woman during their reproductive years. These microorganisms are the Candida albicans and the Lactobacillus species. So as we all know, the estrogen, it is a pH in the vagina 3.5 to 4. We all know the lactobacilli acidogenic corynebacteria. So this already I have discussed, so I will skip. So we say when there's a vaginal infection, the overgrowth of the bacteria, which is normally present in the vagina, while in the vaginitis, the inflammation of vagina. In the different vaginal infections, either the bacterial vaginosis, trichomoniasis, or candidiasis, the complication, if it is not treated, either may convert into the pelvic inflammatory disease, the persistent discomfort, or the infertility patients usually present. While during pregnancy, if there is a lot of discharge problem, there is increased chances of the risk of the miscarriage. Preterm birth, we all know there are a lot of studies and lot of new papers have come, the role of this microbiota in the treatment of the preterm labor, also for the prevention of that. And of course, in the PROM, we are already giving. Now, in some patients where there is a doubt of the preterm birth, especially the twin pregnancy, triplet pregnancy, we also give this in the patients with a low birth weight and in the patients with a post-abortion endometritis. So now, what are the current treatment options available for the vaginal infection? So here we can see, friends, antibiotics and antifungals remain the mainstay of therapy. The recurrence rate is high and associated with side effects. So vaginal microbiota in pregnancy, the microbiota in the pregnant vagina is less rich and less diverse as compared to the non-pregnant vagina, with a predominance of lactobacillus species, a significantly higher stability of vaginal microbiota in the early stages of pregnancy, and the same increased with the gestational age. So we all are aware the etiology, including the estrogen, increases the thickness of vaginal mucosa, thereby increasing the glycogen deposition. The glycogen deposition acts as a chemotactic agent for the microbes, as this is a major substrate used by these microbes, which is broken to glucose and then fermented to lactic acid, and thereby playing a significant role in lowering the vaginal pH. So we know there are a lot of factors has been reported that modify the vaginal microbiota. We all know smoking, cancer in the pregnancy, post-menopause, we all are aware, low estrogen and glycogen levels, childhood, aerobic vaginitis and bacterial vaginosis. So now, just a second, this is something patient. Just a second, just a second. So friends, here we have seen that how it acts. Let me show this completely. We are aware that increases the concentration of the interleukin-1 beta in the vaginal environment, which in turn trigger the generation of reactive oxygen species, which in turn affects the membrane integrity and flexibility, impairs both tail motion and sperm oocyte fusion, and thus it disrupts the fertilization and implantation. Because these days all the patients who are approaching us are all the tech savvy. So once you are writing any of the medication, you have to explain the patient that why you have started this, so how it acts. So this slide very clearly explains that how why it is necessary to give this microbiota preparations in the patients of the infertility, how it will help. So there are the different methods of the vaginal microbiome restoration. Either the oral probiotics, the food grade supplements in the form of the capsules or milk, which contains the live microorganisms, mostly comprised of the lactobacillus. Vaginal probiotics, live microorganisms in the form of the capsules, creams, gels, suppositories, rings, and bioadhesive solutions, mostly comprised of the lactobacillus. Cervical microbiome transplants, the cervicovaginal secretions transferred from one healthy woman to another, microbes characterized with 116S rDNA sequencing, and donors must be screened. So looking for the future, the probiotics containing the lactobacillus used over a long period as an alternative to antibiotics, particularly within the context of high infection recurrence rates, possibility of harnessing specific bacterial strains in order to prime the vaginal microbiota in the pre and periconceptual periods. So now to clarify that what are the pre and probiotics. So friends, as we are aware, these probiotics are the live microorganisms which when administered in adequate amounts confer to a health benefit to the host. Main type of the microbes is the lactic acid bacteria. Bifidobacteria are commonly found in fermented foods. Live cultures are usually added yogurt and the other dietary supplements. So the function of this prebiotics are the compounds in the food that induce the growth or the activity of the beneficial microorganism. So what we are giving is the combination of pre and probiotics, that is the symbiotics. So here to clarify that the prebiotics are the compound in the food which induce the growth of the beneficial microorganism. And here we can see once again, the probiotics are actually the live microorganisms. So there are different preparations are coming for the microbiota from the different companies. Some requires the maintenance of the cold chain. They are having their different pros and cons. So yeah. So how this act, the mechanism is the lactobacillus and bifidobacterium. How it will help and increase in the innate immune system. As we know, we can see this last one, the regulation of the cytokine expression, modulation of phagocytosis, modulation of IDC maturation, modulation of the T cell differentiation. And here with the intestinal microbiota, the competition and cooperation nutrients, bile metabolism, antimicrobial compound production, competitive exclusion, etc. So there are a lot of studies have come for this potential pre-probiotics, the acid and bile stability, production of antimicrobial substances, adherence to human intestinal cell, persistence in the human intestinal tract, clinically validated and documented health effect, antagonism against the enteric pathogens, susceptible to antibiotics, safety in food and clinical use. So only there are some restrictions has been reported like bacteremia, adverse immunological effects, antibiotic resistance transfer, and diagnosed with immunosuppression, prior prolonged hospitalization, prior surgical interventions, antibiotic resistance transfer, plasmid in lactic acid bacteria, possibility of transfer of a tetracycline resistance plasmid. Different strains has been reported with the different studies. So now only when in which patients we can't give this probiotics, only the some restrictions has been reported in the literature in the patients of the immunocompromised, in the premature infants, in the patients suffering from short bowel syndrome, or those with the central venous line, elderly, and the patients with the cardiac valve disease. So the studies have shown the probiotics for the infection treatment, the new problems created by antibiotics disrupt the protective flora, antibiotic resistance due to the abuse and overuse of antibiotic prescriptions, running out of antibiotics, interest in the usage of the ecological methods instead. So vaginal probiotics rational to develop clear hypothesis about the role of lactobacilli, clearly establish the protective role of lactobacilli. So studies have shown the application can be topical, and there are a lot of clinical trials have done. So studies have shown good results in the patients with the to prevent the preterm labor. Also, some studies have come in the use in the patients of the sexually transmitted disease. It acts as a placebo plus nutraceutical. Of course, not only the placebo, definitely the patient is going to get benefit from this. It can be inserted. Now the different preparations are available, oral and vaginal both. So oral preparation from gut to vagina used in the women prone to urogenital infections during infection, but also in the healthy females with the normal vaginal flora. So especially in the patients with repeated UTI, and also give the good results. As we know, the antibiotics damage the common cell microflora, which can increase the occurrence of resistant bacteria, can have adverse side effects. Probiotics can be used in adjunction to antibiotics to restore the commonest microflora. So the different treatments, different is available. So what is the ideal to provide the vaginal specific strain? The maximum colony forming units, minimum is the 10 billion colony forming unit. So there are a lot of studies regarding in the favor of this, the biological control of vaginosis to improve the reproductive health. Several studies has been reported that abnormal vaginal microbiota may be associated with the poor reproductive outcomes. In the prospective study in the IVF patients has been done by Jensen and Thompson. That 10 studies have come from this is again presented in the British Medical Journal, that products with the strains of the Western origin which may not have the same benefits to the patient, it is now widely accepted that native strains will have better efficacy to the local population. The vaginal microbiome as a tool to predict the IVF success, the study has been presented recently in the March 2020 in the European PMC. The studies have shown the local microbiota, especially in the absence or presence of the specific microbes within the parts of the female reproductive tract, seems to be associated with the outcome of ART. Again, the studies have come, this is also presented in 2019, the effect of the vaginal microbiome on the pregnancy rate in the women received assisted reproductive treatment. So again, the studies has been presented in the American Journal of the Obs and Gynec. There are a lot of studies are there. Again, one more study has been presented in June 2020. The disordered vaginal microbiota is a potential indicator for a higher failure or in IVF. The conclusion of this study, they have found out that the age, endometrial thickness, and reduction of the lactobacillus and the overgrowth of Gardnerella, Atopium, and Prevotella possess a strong connection with the success of the IVF, and the bacterial intervention via restoring the vaginal microbial diversity to health status may be a good choice to enhance the positive reproductive outcomes of IVF. So no harm in giving the additional this microbiota preparation, anyhow is going to benefit the patients. So studies have been presented in the European Journal of Obs and Gynec that in the patients who are treated with bacterial vaginosis, the rates of the pregnancy has been reported up to 49%, while in untreated is 24%. Again, the studies have come in 2021. The recent studies have come to understand the reproductive microbiome associated with infertility through the metagenomic analysis. So the study have also concluded that alteration of the reproductive tract microbiota, or a presence of a certain microbiota, irrespective of the level of the pathogenicity, may interfere with the fertilization, implantation, and subsequent embryo development. This may lead to failed fertility treatments and reduce live birth rate. So, conclusion of all these studies indicated the fertility problems may be due to pathogenic changes in the microbiome of the female reproductive tract from the vagina to the upper genital tract, local microbial deformation caused by the blood transmission of the infectious microorganism, or retrograde spread of the peritoneal cavity. So studies have shown that in a lot of patients a very good results with the use of this. So the dysbiosis in the vaginal microbiome can be a cause of the female infertility and embryo implantation failure in IVF cannot be ignored. A complex interaction of the lactobacillus species plays a pivotal role of the equilibrium of the normal vaginal flora in the particular appropriate levels of lactobacillus crispatus and are involved as protective factor for asymptomatic bacterial vaginosis. So there is a studies have shown that the probiotics are not just for gut health. The probiotics can improve the fertility and help to prevent the infections also. They help to reduce the inflammation, which improves fertility. Not only for women, but also for men, probiotics improve the sperm health and increases the chances of pregnancy. And once we counsel the patient properly, so patients are ready to take also. So thank you, friends, for your patient hearing and for your interest and time. I know the topic is very monotonous, so if any questions, I will be happy to answer and we can discuss that also. Good to see so many friends have joined. Hi Rekha ji, kaise ho? Hi Dr. Poonam. Hello Sushma
Hello,
madam.
hello, ha.
Hello.
Dr. Ritu. It was a very nice and elaborate talk, very vividly. Like so many things we got in revision also, and some new things like sperm quality is improved by prebiotics. Very nicely
Actually,
elaborated.
there's
Very
lot and
nice
lot.
talk.
Thank you. Lot and lot can be covered, but अभी जितना हो सकता है ना half an hour में. Thank
Yes,
you. Thank you for joining, Rekha ji.
thanks a lot for all your enlightenment, and like even these small talks also keep on updating. So many in every talk of yours, I usually find something, 2 or 3 things new.
Thank you, Rekha ji. Thank you. Renu madam has also joined, na? Yeah. Thank you, Renu
Yes,
madam.
It was really very nice lecture, Ritu. I always want to join you, but I don't know. Whenever I am free and I see, I definitely want to join you.
Thank you,
As
Renu
Rekha
madam.
said, there's always you get some new point, and your presentation is always excellent.
Thank you, Renu madam. Thank you so much. Thank you.
Renu madam always joins, though she is very busy. This I have seen.
I want to join, but whenever I come in time, so I definitely like to join this.
Ritu, you should
madam.
always give us a reminder at 8:20 or something. Today you did
She
that very good
definitely
job.
gives. She always gives.
Acha. Oh.
Usually it is there, but we don't see notification regularly.
Oh. Acha. Sorry.
Otherwise, always there is a reminder at 8:30.
Okay. Very nice.
So I will keep in mind. That also. Yeah.
And it is mostly there. Whenever I see it, I definitely join. But we don't
thank you.
Whenever we come home, we keep mobile. We don't want
we
to see
miss
the
out. Very good time. The time
so
is
it
also
is
very good.
We were it starts at sharp 8:30 and always on Thursday. So it is a fixed one.
Oh, acha, on Thursdays. Oh, very good.
It is on Thursday at 8:30 always.
Okay, thank you, ma'am. Oh, then it is.
I see on Thursdays. Usually मैं आफ्टरनून में देख लेती हूँ कि आज लेक्चर है इसका कि नहीं है. जब मैं आ जाती हूँ 8:30 बजे तो मैं जरूर ऑन कर लेती हूँ.
Thank you, madam. Thank you so much. Thank you.
Okay.
Thank you.
Okay, congratulations once again.
Thank you, रेखा जी. Hopefully आप सबसे मुलाकात होगी कोलकाता में. आप लोग आ रहे हो, रेनू मैडम?
No, I am not joining.
नहीं आ रहे हो. रेखा जी आप आ रहे हो?
हाँ, कोलकाता हुआ है ना, इस साल में भी उसमें 2 बार हुआ है, तो अब वही हो जाता है थोड़ा कॉन्फ्रेंस में. मतलब व्हेन यू गेट टू सी अ न्यू सिटी तो ज्यादा चार्म रहता है ना, तो इस बार आएगा कि कहीं घूमने को भी मिले, ये लगता है.
अच्छा, आप लोग भोपाल जा रहे होगे, है ना? हाँ,
भोपाल. हाँ, ये कब है डॉक्टर रितु?
भोपाल शायद फेब में है, फेब में. हाँ,
अच्छा, ओके. ये AICO जी क्या?
ना इसकी कॉन्फ्रेंस है ना, दूसरी कॉन्फ्रेंस है इसके बाद। हाँ, इसके बाद
Okay.
दूसरी कॉन्फ्रेंस जो है भोपाल में है। तो
अच्छा।
मुझे तो कोलकाता से स्पेशल अटैचमेंट है, माय बर्थ प्लेस इज कोलकाता। तो
Oh,
आई तो डेफिनेटली वांट टू गो, जितनी बार भी जाने
yes,
को
yes,
मिले।
yes, बिल्कुल बिल्कुल
हाँ
जाना चाहिए, जाना चाहिए। हाँ
Ritu,
हाँ हाँ।
जी।
okay, bye bye. I would
हाँ
like to leave.
हाँ, ओके, यस वी विल वाइंड अप,
Okay, okay. Thank you, ma'am. Thank you, ma'am.
हाँ, थैंक यू। So thank you, friends, those who
Thank
all
you,
have
ma'am.
joined. Yeah. Thank you once again, Shield Pharma. So with this, we will wind up for today. Nishant, I think there are no
Yes,
more
ma'am.
questions. Yeah.
Yes, ma'am. Yes,
Yeah.
ma'am.
Yeah.
So next Thursday we are back with icons with Dr. Ritu Santwani
Yes.
at 8:30 p.m.
Yeah.
Okay, ma'am.
Okay.
Okay.
Bye bye. Good night.
Bye.